All right. Thank you, Kelly. Welcome, everybody, to our complimentary webinar on the AACS Certified Fellowships. I'm Jacob Hayavi. I'm one of the General Cosmetic Surgery Fellowship Directors. I'm practicing in Rancho Cucamonga, Southern California. And we have Dr. Tanuj Nakra with us, who's a program director in Austin, Texas. He's a facial cosmetic surgery program director. And we have a number of past fellows, current fellows that are here with us that can answer your questions. The goal of our webinar is to really give you guys an insight into what do the fellowships offer and who do we look for really. In past, I think I let everybody introduce themselves and talk a little bit about their experience. We're going to do that, but I think before we do that, I want to have Tanuj and me as fellowship directors say what kind of a fellow are we looking for, right? Tanuj, I'll let you start with that. What do you look for when you are interviewing for your fellowship?
Thanks, Jacob. Thanks, Kelly. Really happy to do this annual event where we have an opportunity to talk about our wonderful American Academy of Cosmetic Surgery Fellowship programs. It's one of the crown jewels of our cosmetic surgery specialty, and it's an honor for me to be a program director in facial cosmetic surgery. Let me just take a quick moment and just introduce myself, and then we'll dive into some of the topics that Jacob will expertly kind of guide us through over the next hour or so. So again, my name is Tanuj Nakra, and I'm an oculofacial plastic surgeon by core specialty. So that's through ophthalmology and an oculofacial plastic surgery fellowship program originally. And so I finished my training about 20 years ago. I also did a cosmetic surgery AACS fellowship at the conclusion of all my core training. And there once was a time where I was in the same shoes as many of you here who are residents and thinking about a career in cosmetic surgery. And I was training in Los Angeles, clearly around a lot of cosmetic surgery, but it really was hard to imagine what the career would be like in cosmetic surgery. So I'm sorry, Jacob, if I'm going off on a different tangent to start,
No,
but I promise I'll
I
come
think
back
that's
to
totally
the
fine because
question.
you're relating to them
Yeah,
very well. Please go on.
yeah. So I thought it might be useful just to tell you my story and my relationship with the AACS. And when I was in training, I had various pathways I was considering. Again, my original training was in oculofacial plastic surgery. I had an opportunity to join the full-time faculty at UCLA and sort of become the surgeon I always had wanted to become. And then I had an opportunity to do the cosmetic surgery fellowship, which took my career in a totally different pathway. I think when you're training and you've come out of medical school and you're in residency and you are training in traditional academic environments, your exposure to medicine after training is very limited, and your ability to envision what you would like your career to look like 10 years from your training time is very difficult. And so, this is 20 years ago, and cosmetic surgery is not exactly what it is today. It's become much more mainstream, and it's on social media, and it's very accessible and more understandable to everybody, including trainees and the lay public. But what I can tell you is that a career in cosmetic surgery is incredibly rewarding. The same joys that occur when you're taking care of somebody with a chronic medical condition, you've saved their life, you've done something dramatic in a traditional medical standpoint. Those same joys happen every single day in a cosmetic surgery clinic. We have patients who are having tears of joy because of how you've changed their life and how much better their quality of life is. And to take people on this journey, which is a very personal journey, as humans, we are so connected to other humans around us, and our appearance plays a core component in how we interact with other humans and honestly ourselves. And because it's such a personal and such a core aspect of being human, the ability to help humans have higher quality of life by giving them good cosmetic surgery outcomes is a privilege that we get to enjoy every day as cosmetic surgeons to take them on this journey. So from a humanistic standpoint, cosmetic surgery has been just a dream come true in being everything that I wanted to get personally out of my career in medicine. Each day I go to work and I feel like I'm making a difference, and it brings a lot of joy to me as patient surgeons to take them on this journey. And then on top of that, I mean, the the actual surgeries that we do in my specialty of facial cosmetic surgery, they're fascinating. They're constantly evolving. It's a beautiful mix of arts and science that is challenging, and every single day is I feel this is kind of a cliche statement for someone who's a happy surgeon 15 to 20 years into my career, but I pinch myself every day because I love what I do. It never feels old. So if you're thinking about a career in cosmetic surgery, you're thinking along the right lines, in my opinion. I have enjoyed my career, and now I'd like to transition my monologue here into talking about American Academy of Cosmetic Surgery. So I got introduced to the AACS when I was a resident and a fellow, and I started by going to the annual meetings. Back then, I was still quite young, Jacob's not that much older than me, but Jacob was one of the kind of the leaders of the AACS,
I don't want
and
to age myself, but I've been in practice for 25 years, Danush.
yeah, yeah.
Just a few
So
years more than you. Yeah.
yeah, just about 7 years more. So, but I was inspired by the opportunity to interact with the other AACS surgeons, and one of the most unique things about the AACS is it's truly multidisciplinary, which, in this day and age, there are meetings that are multidisciplinary. There are organizations that say they're multidisciplinary. I don't think there's really anything like the ACS in this world where you actually truly have surgeons from multiple specialties all swimming together in the same direction, rowing together, whatever the analogy is. We are all have the same goals. We have a singular mindset about improving the quality and safety of cosmetic surgery in this country and beyond. And you have leaders from the different specialties all coming together. Of course, there's the annual meeting, but we have multiple opportunities throughout the year to interact with each other. Um, I think that probably on a weekly basis, I'm texting or communicating or interfacing with some of my AACS colleagues. Early on in my career, I was asking a lot of questions, getting a lot of advice, trying to make myself a better cosmetic surgeon, navigating the environment that I'm in. I'm in Austin, Texas. Connecting with people in my state. And now that I'm kind of, I've just turned 50 this past year. I'm now, I guess, in the second half of my career. And so now I'm doing more of offering opportunities for surgeons to come visit, and people are communicating with me and I'm offering them advice. So it's an opportunity for me now to kind of start giving back a little bit to an organization that gave me so much. So it's a network of friends. It's a truly multidisciplinary professional association that I think deeply impacts all of the members of the ACS in improving our own practices and making our careers more successful from every angle. So I'll pause right there.
Couldn't
That was
agree
just
more.
I just wanted to introduce myself, the journey that I went on, a little bit about my relationship with the ACS and why I'm enthusiastically, a program director with the ACS. So I think Jacob, you had asked, what do we look for in fellows?
Right.
I
You,
think
you
that. Sorry, go
Well,
ahead.
let me ask you before you say that,
Yeah.
one of the things that I think is unique to the academy is the fact that everybody wants to be teaching and learning at the same time. So we're all excited about advancing the specialty and getting better. And I think a few of
Yes.
us have taken it to the next level where we enjoy training other people. So you've known you for many years and you've always liked to be involved in lecturing, teaching, and I'm so happy that you're a fellowship director now for so many years. Um, Now you can go into why and how do you pick your fellows? What do you look in a fellow? And I'll say my piece as well.
Well, I think that the way I look at our fellowship program, and I think this applies for all the programs, I feel that we are custodians of an incredible vehicle that has the opportunity to transform a trainee's life and their career in a way that is hard for them to even fully understand and fathom when they're entering this process of training. The medical education process is, you do one step and then you do the next step. And when you finish internship, it's residency, fellowship. And so you're going from one step to the next. And it's hard to really fully see the big picture of your life. And these fellowship programs are an incredible opportunity to transform your career and give you the skills to be a confident cosmetic surgeon that delivers quality care to your patients, um, introduces you to a professional network that for the rest of your career you will continue to tap into, which will build your ongoing skill set and your professional network, which of course is critical to ongoing evolution of your own practice. And then, you know, it's all other aspects of what the fellowship gives you is, you know, in this modern day of medicine and the changes that are occurring with reimbursement, being able to um, create a career that is independent of what's happening with reimbursement-based medicine is it future proofs your financial reality into your future. So it doesn't matter what happens with Medicare and Medicaid and insurance carriers and the constant battles that have to occur from a functional medicine standpoint. My practice has a healthy component of reimbursement-based medicine. I like taking care of patients who need insurance-covered surgeries, but on the other hand, cosmetic surgery gives you freedom to be able to practice whatever career you want, knowing that you will have an income stream that is consistent, will grow much more rapidly than reimbursement-based medicine ever could. And it'll give you financial independence for your family for generations. And so, without mentioning actual numbers, cosmetic surgeons are some of the most highly compensated physicians on the planet. And
But you're
so,
not okay. I'm gonna cut you off there because I don't want as a fellow applying to become a fellow in our program. I don't want you to be thinking about money.
yeah,
Really,
yeah. No, you're
really.
right, Jacob. The reason why I mention all of that is I think it is so important for fellows to understand what a gift it is to get a fellowship training opportunity in an ACS program. And so I think that brings me to my point. What are we looking for? We're looking for people who recognize that gift, who are willing to um, take the opportunity that this fellowship gives them and make the most out of it, suck the marrow out of the fellowship, bring their 100% attitude, energy, enthusiasm to the fellowship, because you have one short year to be able to absorb all of this massive amount of information, not just how to do surgeries, but how to think, how to process cosmetic surgery, patient examinations, communicate with patients. It's a very short year. And so we're looking for people who have that attitude of hunger that grit and determination to be able to make the most out of this year. And to Jacob's last point, we are not interested in training people who are selfishly wanting to just put themselves first and choose this career path because, for example, maybe they just want to make a lot of money. We're looking for people who are truly, sincerely passionate about cosmetic surgery. I really only want to train fellows who are 100% committed to giving back to the specialty. I want to train people who are enthusiastic about maintaining their professional relationships with their societies and going back and teaching and honestly developing their techniques so that when they come back to conferences, they can actually teach and expand and develop the procedures so that we can all get better. I look forward to having our fellows, give lectures at meetings where I'm learning from them. So
Yes.
that's what we're trying to do. We're trying to identify people who can take the program seriously and go to the full extent of what that program can offer them.
Great. Thank you. I think you said it very well. The fellowships are 1 year fellowships, whether it's in facial or general cosmetic surgery. And the year goes by pretty quick, but you learn a lot. So what we look for, and I agree with what Tanush said, but is we're looking for people that are passionate about this. They're driven, they're dedicated, they are, I know a lot of you are general surgeons, and general surgeons have, the prototype or the, characteristic of I know it all and I do it my way. No, you have to have humility. You may have learned the basic principles of surgery or doing, gallbladder or appendectomy or some other bowel surgery. You have to have respect and humility to be able to learn the specific techniques that we are willing to teach you to get amazing results in a safe and predictable manner. I don't know how many times and we learn from our fellows as well. It's a mutual relationship. We enjoy it. I enjoy having fellows because I love to teach, but I also learn from them. And I'm sure it's the same for you, Tanush. But we want people that are here not for selfish reasons, but for reasons that are, they're serious, they're dedicated, they want to become successful cosmetic surgeons, and they want to be involved. They want to evolve, and they want to, develop things themselves, and they want to contribute and come back and teach other people. We want to grow this academy. We want to grow our board certified diplomats around the country. That is our goal. We want you to be a fully fledged active member of this huge family, which is called the Cosmetic Surgery Academy. So the fellowships are there. I think to have a fellow in our practice, right? We are dealing with private patients who are coming in and are trusting us with their face, with their body, and to know that there is somebody else there, it's not a given. As Tanuj said, it is a gift, right? And we have built practices like my entire office is dedicated to the fellowship. You're not just learning from me, you're learning from my staff, you're learning from my techs, you're learning from my anesthetist, my coordinators. And that's one of the biggest advantages, right? You're not in a hospital setting. All of you in a residency are currently in some kind of a hospital setting. And when you practice aesthetic cosmetic surgery, that is usually not performed in a hospital environment. It's performed in an outpatient basis in practices like mine and Tanuj. And one of the biggest advantages of doing the fellowship in this setting is that you learn everything that is involved in being successful in running a practice like this, like having a successful surgery center running, accreditation, talking about how to deal with problems, complications, that continuity of care that you see the entire year, having being involved with the patient from the moment they walk in for the consultation through the process of pre-op as well as surgery in the operating room and post-op care. All of that is very comprehensive training. And that's the only way you get it really is in a fellowship. There is no residency in all of the specialties that we have, including plastic surgery, that teaches you that continuity in a full year in this manner. That's why the fellowships exist. And so I'm going to segue here to our current fellows. And I think we have a few of them here. Dr. Araim, are you with us?
Hi, can
Yes.
you hear me?
Yes, I can hear you.
Hello,
Uh,
everyone.
can you tell us about your pathway and how did you hear about the fellowship and tell us how's it going?
Sure. So, my name's Marwan Araim. I was born in Baghdad, raised in New York. I did general surgery in New York City, in Harlem. I heard about this through word of mouth. I do have a family friend who's in plastics, which I always liked the cosmetic part of it, but I never really was drawn to the reconstructive part. So I didn't really, I never thought I would apply to plastics. When I ended up hearing about cosmetic surgery in third year, I was really excited. I looked into it, and I applied. I ended up during my interviews going to about like seven different places, and it was just such a different experience. Everybody I met was it just seemed so much happier than what I had been used to in the hospital. That was a big draw. Everyone was much nicer and just like a normal person. The other part of it that that I noticed was during the interview, I actually like I scrubbed in and I operated with everyone I interviewed with, which is a lot different than traditional interviews where you're sitting at the desk in a suit and talking to the program director and they don't really get to know you. But this was more so like very personal, and I really liked that. Um, the thing that I liked about cosmetic surgery is it's kind of the finesse, the artwork of it, making everything look nice for people. Everything matters a lot more in the way it looks, which I personally like. I'm obsessive, and that was never really an experience I had in residency. It was always just more like, move, 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 get the job done, and we're saving their life. Doesn't matter what it looks like, and I never really was drawn to that out of general surgery. I'm currently in Miami. I'm with Dr. Karlinski at Alluring Plastic Surgery, and from the start up until now, I've learned so much, and I know that I'm going to continue learning a lot. It's only a year, which was, it made me nervous considering plastics was three, but now that it started, I'm fairly confident that I'm going to be ready to, you know, hold my own on a career when I start off like as an attending. Did I
What
get
do you wish?
everything?
I have a question for you. What do you wish you knew when you first started your fellowship? So, to the people that are applying now, what do you wish you knew before when you started the fellowship?
Something I wish I knew when I was applying. I guess it would have been to spend more time. Like when I was a four or a five, for example, it felt wrong to skip out on a colon to go do a tummy tuck or a breast lift, for example. So I was in general
Hmm.
surgery, but looking back, I wish I took more time to just spend way more time with them and learn and prepare better for the fellowship. I guess that's one thing. Another thing that I wish I knew would be how personal it is with the patients. It's not something that I mind. I just, it hit me by surprise. In residency, it's very impersonal. You really don't get much follow up. You don't really know them beforehand. You read about them in a chart and then you operate and you never see them again. Here,
Right.
it's a lot different. They're it's a very personal relationship. You meet them beforehand, you talk to them. I don't know how it is at other places, but we have a phone here where they're in constant contact with us. It gets overwhelming sometimes, but overall, it's fine. So
All right.
we're
Great.
always in contact with them.
Thank you, Marwan. I appreciate it.
Thank you.
Dr. Tosani, I see that you're on. Tell us about your pathway and how did you decide on this fellowship? And I oftentimes, Dr. Tosani is training with me, oftentimes tell my fellows before they start that this year will be it's a 1 year training, but this year will be the best year in your training because it will shape your career for the rest of your life. And not to put you on the spot, but how's it going?
It's
And how
going
did you decide on
wonderful.
this?
So I didn't hear about cosmetic surgery until I was in the tail end of my research year, which was, I guess, before my fourth year. I heard it was a word of mouth thing, and then I attended one of these webinars and got a little bit more information. And then I did extensive research for 3 to 4 months before I finally committed to this pathway. Um, I was very skeptical initially when I heard about it because I had a lot of mentors around me from plastic surgery background who put an absolute no stop towards like any of this. So I was very skeptical, very scared, but I did a lot of research for 3 to 4 months and committed to it because my gut was telling me that this is legit and this is not like a weekend course as people advertise it to be outside of the cosmetic surgery world. But the fellowship's going great. We get to operate a bunch. Like Marwan said, that one of the things that I appreciated the most during the interview process was how personal it was. Like you get to be in your element in the OR. As a surgeon, what more can you ask for? So, the interview process was something that was so unique. And I just like knew being in the OR and not even having malpractice or anything like that, I got to be scrub in and actually experience the whole surgery. And I got to see what the other fella got to do during the whole interview process. And I will say that having talked to a bunch of plastic surgery residents and fellows, one of the things that was a concern in terms of cosmetic surgery or aesthetic surgery from plastic surgery training was you don't get much hands-on training. And here I witnessed that the fellow was doing an entire side by themselves while the attending was doing the other side. It's truly a hands-on experience. So I really appreciated that. And then to top it all off, like everyone here is like super happy and excited to show up to work every day. It's not like you have to drag yourself out of your bed and, moan and groan and count down your days because you're so miserable. Everybody's so happy. And in general, my attitude right this year is different than when it was when I was a general surgery resident. General surgery resident, I had a calendar. I don't have a calendar right now, and I didn't even realize that it's already November. It's going by too quick.
Yes, excellent. Thank you. Dr. Avdik, Armin Avdik, are you on? I don't think Armin is on right now.
I can, Dr. Harvey, I'm here with Pranjal.
Yes, go ahead,
Yeah.
Dr. Fine.
Hi, I'm Carrie Fine, Dr. Harvey, senior resident or senior fellow right now. My path to this field was pretty similar to a lot of other people's, where I wasn't really aware of the specialty until later in my third year. Had already been in the process of applying for plastic surgery fellowships, despite not wanting to do any of the reconstruction or hand. That's really the only pathway that I was aware of. So you all who are on here right now are pretty fortunate to be aware of this ahead of time. Um, my interview process and the whole process getting into the fellowship was, I mean, pretty easy. I was pretty close to this Dr. Harvey's practice, so it worked out really well coming in here for an interview. But yeah, like everybody's mentioned, the interview process was super laid back, in the OR, just chatting, kind of getting to get a vibe for everybody that you're going to be working with, seeing if, your vibe works right with them. And then the actual sit down process of an interview was very laid back and more just getting to know you on a personal level to see if, you're going to match right with the specialty and the, practice that you're applying to. What I'd say that surprised me about this specialty, I mean, there's so much creativity and even more creativity than I expected. I mean, today we did breast self augmentation or auto augmentation using their own breast tissue to rearrange it and almost act like an implant without an implant while doing a lift. And we've done buttock self-augmentation with the tissue when you're doing a lower body lift, using that tissue that otherwise you'd excise and tucking that into the buttock to use as a flap to reconstruct the tissue. So, I mean, we really do a ton of creative things. And what's cool is whenever there's conferences or just another, attending somewhere else that's talked about a certain technique, I mean, Dr. Hyvey's super open about just trying it ASAP. I mean, as soon as we have the right candidate, we'll give it a shot. Things like, the open book abdominoplasty, where you're cutting the lower and the upper flap and down the center. I mean, he's super open to trying any techniques that we find, interesting results for, which is just amazing to be able to get these experiences.
Well, as Dr. Nakra said, that the specialty evolves all the time, and new techniques and technologies develop. And of course, if we are able to and we have the right patient, we want to try them. And we want to also teach them to other people because you get superior results. Um, but majority of the time, we're really doing, all the things that are standard, right? Whether you're in a general cosmetic surgery. I know that some people wonder if you're doing general, do you get, I think one of the questions that were sent, do you get to do any facelift? Do you get to see any blepharoplasties? So maybe one of the other general, or you guys can answer that question. When you're doing a general cosmetic surgery fellowship, how much face do you get?
So I can answer that for now since I'm with you. I mean, I'm sure this varies practice to practice, but at least at this facility, I'd say it's 60% body to 40% face, if not, I mean, almost 50%, depending on the time of the year. I mean, I think in the past 1 or 2 months, we've had at least 4 to 6 deep plane face and neck lifts. And throughout my training, I'm sure it's been at least 25, full deep plane facelifts. And I've only been with Dr. Hyvey for almost not even like 5 months yet. So in the second half, we transition. We do half with Dr. Ryan and then half with him.
Yeah.
So, but blepharoplasty, I mean, we do a ton, brow lift, pretty much every facial procedure. I'd say it's even slightly more than 40% here.
But it can vary from program to program.
Yeah.
So you really have to go and visit the programs. One of the things that some of the residents that are interested in seeing what the program is all about, you can of course come in and interview and visit with us, but you can actually do a rotation before even the entire interview process. And I don't know, Tanuj, if you had residents do rotations with you. I've had several residents do a whole month rotation with me, and I think that gives them a great insight into the program. If you're particularly interested in a location or in a specific program, I encourage you to, get in touch with the program director and try and arrange a rotation. We've had accredited full month rotations with several residents over the years. Let's go ahead and let's ask Dr. Chin. Is Dr. Chin on? I think I saw his name.
Hi, Doc.
Hi,
Yes,
Mike.
I'm here. Hey,
All
nice to
right,
meet you.
Mike, tell us how is your fellowship going? What's your background? And what has been a surprise to you in your fellowship from what you expected?
Okay. Hi, everybody. I'm Dr. Chin. I'm with Dr. Deal in Chattanooga and also in Georgia. I did my residency in general surgery in New York. Um, I got interested in cosmetic. I initially actually didn't know about cosmetic surgery until my chief resident actually told me about it. My mentor was a plastic surgeon, and so I always had an idea that, oh, after general surgery I will apply for plastic surgery fellowship. However, I always intended to do the cosmetic side of it. I was never interested in hands, micro, or anything like that. I really was focusing on like the cosmetic part of plastic surgery. And then I did more research, and then I realized this fellowship is exactly what I wanted, and it gave me everything what I needed. So I did some several interviews, some seven, I think 7 or 8 places, and there are like every place was great, but I just found place that fits me more, like my personality and what I was really looking for, and so I end up in Chattanooga with Dr. Deal, and it's been so far. It's been absolutely excellent. I think in the past 4 months, I got over close to 500 procedures. So by the end of graduating this fellowship, I feel like I'm going to be very confident in being able to venture on my own. But obviously, it's a life learning career, so it doesn't. There's no such a thing as, oh, you'll be the master of everything. It's always a learning thing. And we actually did an open book yesterday with some. I know someone just mentioned that, and I actually did a fluidity today. So and tomorrow we have like thigh-plasty, brachioplasty. So I definitely have more procedure than I asked for. So this is great. It's been absolutely great, and I definitely recommend any of everyone here who is interested in going to cosmetic surgery. Is absolutely fantastic fellowship opportunities here, and very many great attendings and networking, especially the conference we have annually with AACS. Highly recommend that everyone to come to that, because you get to meet the fellows, the attendings, and the program directors. Yeah.
Yeah, thank you for mentioning that. I think that the AACS annual scientific program is a great way to get to know the people in the academy as well as the fellowship directors. Many of them come to the meeting, they lecture at the meetings, and there is actually opportunity to meet people. If you are prospective fellow, they do have little luncheons and breakout sessions where you can meet some of the attendings and talk to them. So I do recommend to do that. Thank you. Dr. Goodyear, tell us about your journey and how fellowship is going, and what has surprised you about your journey.
Yes, so I'm actually not a general surgeon. I did residency in ophthalmology at UCLA, and I knew I wanted to do kind of facial cosmetic surgery as part of my practice. And I did ASOPers as well, which is oculoplastics, and orbit surgery, which is something that some ophthalmologists do after training. But I wanted additional training, particularly in facelifting and neck lifting and kind of the full gamut of facial cosmetics. And I am with Dr. Nakra in Austin. I love fellowship. It is so much better than residency. It's great to be able to do what you love every day. And I
That's
think
great.
something that surprised me is it is a fellowship, but I am learning insane amounts every day, but I feel more, not necessarily independent, although you do obviously have more independence than residency, but you really are making decisions and kind of acting as like the true surgeon for a lot of these patients, even though a lot of these patients are Dr. Nakras, even though I am able to see my own and I have my own fellows clinic patients that I can sign up. It's a lot more autonomy and independence, and it's so nice to be able to have that, as opposed to kind of residency. Someone else mentioned, you don't really see the patients pre-op, you kind of read the chart, you do the surgery. Sometimes you see them as a post-op, sometimes you don't. And here you get to see them from start to finish, which is really great and excellent for education. And I write little notes on all my post-ops, and it's been so amazing.
Yes, that's great. I think what all of our fellows would attest to that, and it's necessary. I think as a surgeon, you need to have that independence to be confident when you come out. And this is a life learning experience. You have to continue to have that drive and curiosity. That's why when Tanush and I are saying we want somebody who's serious about this specialty, who's, has the drive, is because we want people that want to constantly improve themselves. They want to constantly evolve because this specialty evolves. And your learning doesn't end at the end of the fellowship. That's just the beginning. You just got the basics. You're going to learn. We constantly learn from each other at every meeting and all the time. So we want people who are passionate about learning, and have a good attitude and want to continue this into their practice. And I'm glad you're getting that. I know you're in an excellent place. Let me call on Holly Calderon. Dr. Calderon, tell us about your journey and how you're doing in your fellowship.
Yeah, hi, I'm Holly Calderon. I am general surgery trained. I was trained in Ohio. I'm now in fellowship in Salt Lake City, Utah, and I'm really enjoying it. I found out about the cosmetic surgery fellowship actually pretty early on in my residency. I had the actual privilege and luck of having one of my attendings be a cosmetic surgeon and general surgeon. So my exact combination. And I got to work with him throughout most of my residency. So he got to introduce that combination and this option to me pretty early in my training. I knew in medical school that I really was interested in plastics, but I kind of wrote it off as an option. Since I was more of a non-traditional student, I'd started medical school after already having a career, and I didn't really want to extend my education by an additional 3 years after 5 years of general surgery training, especially since I was doing my residency training at a distance from family. It just sounded pretty tedious, and I just didn't want to go down that road. But when I found out about the cosmetic surgery training option, it was really interesting to me. It provided exactly what I wanted in training without the things in a 3-year fellowship for plastics that I didn't necessarily want. With my general surgery training, there's a lot of things in our training that we get trained on, but we never actually end up using or want to use. And that was going to be the same thing with plastics for me. I didn't necessarily want to do hand surgery, repairing broken jaws, broken hands, doing burn surgery, etc. I was really interested in the cosmetic portion, and looking at this option, this is exactly what I wanted and was interested in. And then also, I'm sure everyone is familiar with that diagram that shows how they compare the difference between cosmetic and plastic surgery. And going through a 1-year cosmetic training fellowship is exceptionally vigorous. It actually requires us to graduate with more procedures in cosmetic surgery than a plastic surgery fellowship would expect of their fellows. So that really appealed to me, and I, applied. I went to a couple conferences, at least 2 or 3 during my fellowship, and got to meet a lot of wonderful people. And now I'm enjoying every minute of my fellowship so far. I'm getting to do the surgeries that I really love. I'm getting to do surgeries that my patients ask of me, that they want me to do, rather than with my general surgery training. A lot of it was trauma heavy, worst day of their lives. It's surgeries that they needed of me, but they didn't want. So it's a different aspect there that I've really enjoyed. What surprised me is time passes really fast. And it's surprising that it's already November. So
Yeah, goes by quick
yeah,
when you're having fun.
I'm having fun. Yeah, it's definitely
Yeah.
general surgery training for sure.
Yeah. Let me call on Dr. Silverton. You are doing a fellowship with Dr. Blyer. Are you?
Yes.
Yes, excellent.
Hi,
Uh,
good evening, everyone.
uh,
So my name is Latoya. I am a Dr. Bly in Long Island, New York. My background is in general surgery, so I actually just completed my residency in June. And I think I got into cosmetic surgery. I'm just kind of thinking back. It was almost like a very fluid thing. Um, I have a friend of the family who's actually OBGYN. And he was that for a while, and he went in and he did the fellowship. Um, in Miami. And one day I was like thinking about, coming down to the end of my residency, thinking about what type of fellowship I want to apply for. And like Holly mentioned, um, my background is a little bit circuitous, and I've taken a lot of different paths on my journey. I also have an MBA. I've done a lot of travel. And it was never anything that was a direct path. But because of that, also I'm older, etc. And it's not, I don't want to spend another 3, 4 years be doing a specialty and having all of those extraneous things that I don't ultimately use. I wanted to really start building a career that I think that one, I could be creative, not just in terms of the OR, but outside of the OR. Two, I could be lucrative, to help my family and also to give back to my community. Three, that I can have a direct impact on patients. Um, Four, that the procedures that I do is things that I enjoy doing. I did a rotation on soft tissue, and I really like the procedures that we were doing. As was mentioned in general surgery, those would be wound or burn or anything like that. But dealing on a skin level and not having to be near a common bile duct, was appealing. Um, and it's things that you can master, and you can really, train yourself to give a very refined product. Um, so all
So
of those
Kaya,
are the
what do you wish you knew when you first started the fellowship? Because you did go through a lot of different things, so you have a very unique pathway. What do you wish you knew before
um
you started your fellowship, or how would you do it differently?
if I had known earlier, I think I would have gone to some of the meetings. So I haven't been to any of the meetings. My first one will be in February. Um, I don't know if there's anything that I wish I knew per se, or what surprised me. What surprised me is that I actually remembered my patients' names. Like they're walking, and it's not something like, oh, let me check the chart, or hi sir, or hi madam. It's like, hi Mary. So that's definitely a change of pace. And then I guess coming along with that, if I were to put it in a wish I knew bracket, it would be that you don't have a hospital. This is not a hospital. Everywhere that we go is a surgery center to some degree. So when you leave at night, I mean, even as a general surgery resident, I take a lot of ownership of my patients. I think I was definitely one who would, follow up and, call at night, if even if I'm not on call, just check in with my junior residents, etc. But now, like truly, you don't have that support system. And I don't think it's necessarily a bad thing, but it's not something that you'll always consider that you can walk off, put your pager down and that's it. You are available 100, 24 hours, or you should be willing to be, because again, these are things that people are doing electively. Um, and they do need the support. Um, and it could become a little bit overwhelming sometimes. Some patients are a little bit more, demanding than others. But I think it's definitely something to consider if you're not a people person, or you can't pretend to be a people person. This is not going to be a field that's for you.
Right. So yeah, we our fellows and us, um, and I don't know how it is at the Dr. Nakra's office, but a lot of our colleagues, we are on call 24/7, and every patient has our cell phone. They can text us or call us. But I'll tell you, very few patients ever abuse that. They are so respectful. And, if we get a call, yes, we get a lot of hand-holding calls, but if we ever get a call in the middle of the night, it usually is an emergency that we need to attend to, and that happens very early. So you are not, the call that you have in a fellowship is nothing compared to your call in a residency. It's completely different. I want to get to, we have a few minutes left. I want to get to some of our past fellows who are on, Dr. Yu and Dr. Al-Harbi. Thank you for being with us tonight. I have a question for you. What was the most challenging thing you had to battle through during your fellowship? And how did you get through it?
Hi, I'm Dr. Yoon. I just finished my fellowship, I guess, back in end of June. The hardest thing about fellowship, I think there's a couple of things, but the one thing that was very striking is, I'm a general surgeon background. I actually love general surgery. I was a trauma surgeon for 5 years. I had a lot of fun with it, but it was just a tough job. So, long story short, I had a friend, Dr. Scott Meridian. I went to medical school with him. He was able to open a fellowship, and I was able to join him. So I kind of had like a very quick route. I saw my friend flourish in the field, so I was able to join him. But being 5 years into a general surgery practice, doing trauma surgery, I think the hardest thing was when you're doing cosmetics, it's like a completely different ball game. You handle the tissues differently, the techniques are different. The definitely, you need to suture really well. But the concepts, the way you think about the surgery is a completely different ball game. So just adapting to that is very tough. Um, I did a fellowship in trauma and critical care, and I did general surgery for a long time. So actually, when I was starting my first attending job as a trauma surgeon, I wasn't too nervous, to be honest. But I was really nervous about starting my first day as a cosmetic surgeon because, I just feel like the stakes are different. You see the results, right then and there, and you post it on Instagram, and you really need to be, sharing your results online. You can't hide from how bad you do. You do a bad, nasty gallbladder, you suture it up, the patient's out of the hospital in a week, but in cosmetic surgery, you make a mistake, a patient's not happy, they'll post about you, and those things really go a long way. So I think those two things are the biggest challenges. But I was in a very busy fellowship. I operated a lot. I was very aggressive. I just knew, what it takes to be successful. So I didn't shy away from any cases. I stayed late, started really early. It was a challenging fellowship. It's not, people make things like, oh, it's cosmetic, it's just glamorous. Like, no, it's you gotta work. You gotta work hard. You gotta suffer. You gotta, for me, I had to humble myself. I was an attending for 5 years, telling people what to do, but I'm the fellow again. So, you're eating dirt again. That was tough, but um, I'm a first year attending now all over again. I'm telling you, it's not easy. It's tough. So, you got to be very prepared to
Thank you for sharing.
do it. Yeah.
Yeah, that's great. Yeah, thank you for sharing. I think we had some people ask, what do you do if you're a mid-career surgeon and you want to do this? So I think you kind of talked about that. If you're serious about it, you do a fellowship and you you humble yourself and you learn these
Yeah, you got to be
things.
humble.
You
It's
get,
it's not
yeah,
easy. It's not
and
easy.
it
Yeah.
and it's
Yeah.
hard work. Well, so thank you
Yeah.
for sharing. Dr. Al Harbi, um, what about you? What do you think was the most challenging thing you had to battle through when coming out?
Yeah, well, first of all, thank you very much for having me again here. This is my second year to talk about my experience with the American Academy of Cosmetic Surgery Fellowship. So I'm very happy overall. I think that this was one of the best decisions I've ever made, like to do this fellowship. Now, the thing that I didn't and I underestimated, like when I knew about my fellowship I did it with Dr. Rustami, Hamra, Niamtu, and Yusufi. So we have four faculty in the fellowship. And I was still like, I'm going to be rotating between them. And they was like, yeah, sure, I can do that. It's easy. And then when I get in Virginia and they saw like Dr. Niamtu was like about 2 hours away from where I live, and they still have to go there. But I think that was one of the challenging that to coordinate between the four faculty, but it's worth it because you see different type of facelifts. Everyone does facelifts different than the others, so it's really worth it. So I'm very happy with that. I learned a lot from all of them, and now I work with Dr. Rostami. She's my mentor, and now I work with her and been with her for a few months, and it has been great so far.
Excellent. All right. Yeah, I think that a lot of the fellowships have more than, it's not a one-man show, right? So I know that Tanuj, you have multiple other surgeons in your practice. I have an associate, and we also have affiliates. I mean, I have my fellows go to Dr. Rifkin. He does the most amazing injectable face transformation and non-surgical rhinoplasties. We have fellows that are interested in doing facelifting, go visit Dr. Goldberg, at UCLA Jules Stein, and they see lifts and brow lifts and all the opto and oculoplastic stuff. They want to see deep plane facelift, they go to Bentale. So there's lots of colleagues that participate in your education, and you just have to be willing to travel to them. It may be an hour drive or 2 hour drives. When I was a fellow, I drove from Abilene, Texas to Dallas Fort Worth multiple times, but I learned stuff. So you have to be dedicated. You have to be willing to give the time and go through the hardship. It's worth it. It's good to see different surgeons doing the same surgery. No, they don't do it the same way, and you learn, even if you learn a small nuance that you can learn from and incorporate into your technique. It's an amazing this is what happens every time we come to a conference, right? It's not like we're learning something completely new. When my fellow said, oh yeah, we did the open book, because we had a patient that fit that model, is just a small change and an extension to what we do already, but it's such a better result. So it's amazing to be able to do that, and you'll be able to do it once you go through a training like this.
And Dr. Harvey, one thing I want to add actually for the fellowships. So the good thing about those fellowships, the community. So I was a fellow last year, and I had the opportunity to present at the annual meeting. And this year, I'm actually on the scientific committee. So they're welcoming the younger generation, the younger fellows, and this fellowship allowed me to be board certified now in facial cosmetic surgery. So it's really it's amazing. And as I said, the community and the connections is really good with this fellowship.
Excellent. I want to ask any of the current fellows or past fellows the last question, because I'm sure that's on everybody's mind. What kind of job opportunities are available after completing the fellowship? Um, so
I can
you can
start.
jump in, whoever wants to answer.
I started applying to jobs maybe not even like 2 weeks into starting my fellowship, my AACS fellowship. I applied to 3 jobs that I know other people were applying to as well. I got offers from all of them, and I had good luck in negotiating my contract because I think I came with the skill set that they're looking for. So it was great.
Right.
And it had a lot of support from Dr. Knocker and my mentors at TOC to help me. So super, super
Excellent.
helpful.
That's great.
So I waited a little bit longer. I kind of started looking about 6 months into my fellowship, maybe 5 months in, just before my co-fellow had finished. I used Doc Cafe, and I, reached out to some program directors in areas where I was looking to move to. And I got results pretty quickly, and interviewed probably about halfway through my fellowship, so around the 6 month mark, and had a job lined up shortly after that. But yeah, there's definitely no shortage of job opportunities, and yeah, it was a pretty smooth process finding what I was looking for, where I wanted to be too.
Yeah, for me, I think it was a little bit easy because I think in the second month in my fellowship, Dr. Rostami offered me a good position and offer. I mean, I didn't really have the option to say no during because I was worried that she's not going to give me the certificate. But no, just kidding. But actually, she gave me a good offer, so I just took it, and I didn't really have to look much. However, when I went to the annual meeting last year in California, I met a couple of surgeons, and they offered me actually some opportunities. So at those meeting, you will find some jobs there too.
Excellent. Are there any questions from the audience? Let me see. Do we have a chat? Any questions in the chat? No questions that I can see. I'll just tell you that every fellowship is different. In our program, we take two fellows, one in July and one in January. The July position goes through the match. The January position is not through the match, so you can apply directly. But if you're interested in any program, I encourage you to get in touch with the program director, email them, call them, try to schedule a visit, try to schedule a rotation. If you have the opportunity, come to our meetings. You'll get to meet a lot of our colleagues and you'll get to meet a lot of the program directors and get to know them. And those are really the ways that you can get more information about the specialty as well as the fellowships. And if there are no further questions, just to be on time, I'm going to say thank you to everybody. I see. Yes, Sue, go ahead.
Hi, everybody. I have a question. I will start my fellowship in January, and I am going to be doing my fellowship in Chicago Breast and Body. And I was just wondering, because our facial and ocular surgery numbers are not that much because most of our surgeons are doing the body surgeries. So is there any opportunity for me to follow maybe a week or two in a different offices who's also providing this kind of fellowship and has also higher numbers of those kind of cases?
Yes, of course.
Yeah,
You
I can comment briefly on that. Yeah, we
yeah,
are
go ahead.
more than happy to. I mean, one of the beautiful things about the AACS organization is that once you're in the family, you're in a fellowship, you've graduated from a program. The AACS is a very friendly community, and we are all very open in sharing and welcoming people to come learn from us. We do have people to come visit us here in Austin. Happy to have you shadow and join us in all the surgeries that we do each day. And I speak for all the facial cosmetic surgery directors. I think everyone would say the same thing, especially if you're an AACS fellow currently. You're sort of kind of in a special category where we'll go out of our way to help you.
Yeah. And actually, on our fellowship committee, we do review your numbers mid-year. And if we see that you are deficient in a certain category, let's say facial surgery, Kelly, and the committee will coordinate at that type of a rotation and tell you that you need to do a rotation somewhere else or get in touch with your program director to set it up for you. So you don't have, yes, this problem. Of course. Yes. Any other questions?
Yes, if I can ask one. I'm Hamid Alipur. I'm a general surgeon, a few years in practice in Louisiana. I did my residency in California, and I've been a few years in practice in a rural hospital here in Louisiana. I'm trying to figure out kind of what pathway I want to kind of navigate my my practice in near future, and this cosmetic surgery is something that I got introduced in recent American College of Surgeons. So I'm trying to kind of get myself more and more familiar with. To make it short, I'm hoping to be able to visit with some of the programs to kind of understand the process better. And I'm actually going to come to visit in California in a few weeks to visit with some of the friends. I was wondering if I can visit with you or some of the programs that might be available to kind of get to know how
Yes.
this works, if possible.
Yes, of course you can. My email is listed on the AACS website, and you can always email me, tell me the dates that you're going to be in town, and we can coordinate something for a visit. Sure.
Awesome. Great. So we'll be in touch then.
Okay. Yes, would
Thank
love to have you. Sure.
We do have a question in the chat, Dr. Hayawi, now.
Okay.
Real
How
quick, I
competitive are they?
apologize. I do have to actually jump onto another call right now. So I just wanted
Thank you,
to
Dr.
take
Nakra.
say goodbye, but also just give a final note to everybody. Thank you all for getting onto the Zoom. Obviously, as you can tell, we're very enthusiastic about our fellowship programs in our society. We look forward to welcoming you. I think that Jacob is absolutely right. If you're thinking about becoming a fellow or joining the society, please come to the meetings, come visit some doctors so you really get a good sense of what a career in cosmetic surgery really is all about. Thank you all very much.
Thank you so much, Dr. Nakra.
Bye-bye.
All right, I see the question. How competitive are the fellowships? Do I need to research in cosmetics during residency to be competitive? The fellowships are competitive. I'll tell you, it depends on the location and where you are. It varies from year to year. Some fellowships will get 10 applicants for the one spot. I've heard fellowships that are getting 19 and 20 applicants for the one spot. Average can be, somewhere between the two. So it is competitive, but you just have to be proactive. If you're proactive, you are emailing the director, you're in touch with the director. I mean, like Dr. Tosani was in touch with me for 2.5 years before she came to our program. Most of my January fellows, get in touch with us years ahead of time and they visit, they do a rotation. So you can get yourself, a better position if you put yourself out there. Do you need to research cosmetic surgery during residency? I'd say yes. The more you know about the field, the more you experience, like one of the current residents said, Dr. Arahim, I think I said he wished he had scrubbed in on those tummy tucks and breast reductions and other cases where he had the opportunity. If you have the opportunity, do it. If you have the opportunity to scrub in on those cases, go to lectures about cosmetic surgery cases, learn from plastic surgeons or other cosmetic surgeons in your hospital, by all means do it. It's just going to make you a better fellow, more knowledgeable, more ready to go, hands-on. Of course, these fellowships are, a one-year program and you get gradually more and more responsibility. The more prepared you are, the more independent you will become sooner, right? If you are unprepared, it will be a steeper hill to climb before you can be independent, like some of the fellows expressed to you today. So that's important. The more preparation you make, the better it is. Okay. I think we're 7 minutes over our time. I appreciate everybody logging in and contributing, all the current fellows, past fellows, and everybody who's interested. If you have any questions, email Kelly or one of us, and we'll be happy to get back to you. Have a good night, everybody.